It's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's the Fritter. I'm your host, Jimmy Apple. How you feeling today, my friends? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. You can't ask for better than that. We have got a good one for you today. Let me ask you a question. Have they ever told you you need a peripherally inserted central catheter? Now, I know what you're thinking. Believe me, when I hear the word catheter, I cringe. I cross my legs, actually. But it's not what you're thinking. Believe me, it's not what you're thinking. I've had it done 4 times. I've had something similar done, what they call a central line, which it's not as bad as it sounds either. I want you to sit back and relax, and Dave is going to explain to you what a peripheral inserted central catheter is. Once you hear what it is, you might realize that you've had it done already. You might realize you've had it done already to you once before, maybe twice before. So sit back and listen to what Dave has to say.
What is a PICC line? A peripherally inserted central catheter, or PICC, is a thin, soft, flexible tube, and intravenous line. Treatments, such as IV medications, can be given through a PICC. Blood for laboratory tests can also be withdrawn from a PICC. A peripherally inserted central catheter, or PICC line, is inserted by a specially trained nurse or doctor who will use an ultrasound machine to find the veins in your upper arm. Your arm will be cleaned and covered with a sterile cloth to prevent infection. Medicine is used to numb the area where the PICC will be placed. The PICC will be inserted into a vein just above the bend of your elbow and guided into a large vein in your chest. Most patients feel little or no discomfort during this procedure. Once the PICC is in place, it is held to your arm with special tape and covered with a sterile dressing. A chest X-ray is taken afterwards to make sure the PICC is in the right place. You will be able to bend your arm and use your arm just as you would without the PICC in place. The benefits of using a PICC are: a PICC is more comfortable compared with the many needle sticks that would have been needed for giving medications and drawing blood. The goal is to spare your veins from these frequent needle sticks. It can also spare your veins and blood vessels from the irritating effects of IV medications. It can be used in the hospital setting, nursing facility, or at home and can stay in place for weeks or months, if needed. It can be used for many types of IV treatments. A PICC can be used to obtain most blood tests. What are the risks during and after placement of a PICC? There may be slight discomfort during the procedure. Bleeding may occur at the insertion site. It is sometimes necessary to attempt more than once, and it may not be possible to insert the entire length of the PICC. During insertion of a PICC, accidental puncture of an artery, nerve, or tendon can occur near the insertion site. However, this is a rare event. A clot may form around the catheter in the vein, thrombosis, which can cause swelling and pain in the arm. Inflammation in a vein, phlebitis, can develop from the use of all types of IVs, including PICCs. An infection may occur at the insertion site or in the bloodstream. The PICC can come out, partially or completely, if not well secured and completely covered. It can move out of position in the vein and may need to be removed or repositioned. It may become blocked. Medication may need to be used to clear it. Other options for receiving IV treatments: short IV catheters can be placed in the arm or hand. These require frequent changes and are not suitable for some solutions and medications. A central venous catheter can be inserted into a vein in the neck, upper chest or groin. This type of catheter is for short-term use, less than 2 weeks, and can only be used in the hospital. There are other permanent types of catheters, Hickman and ports, that are inserted in the operating room. I'd like to point out that our own Jimmy Apple has a PICC line in his left arm for 5 weeks now and is receiving IV antibiotics at home. And this is not his first rodeo. This is his 4th time with a PICC line, and he's had a central line while in the hospital. I hope you found this information interesting and helpful. Now, I'm gonna pass this back over to Jimmy.
Thanks, David. And he's right. I do have a PICC line in. I've had it in now for 5 weeks. I'm going to have it in for another 2. So they tell me it may go on a little bit longer. I have it in because I was in the hospital, I had the infection, and I'm getting IV antibiotics pumped into me. Right now, twice a day, and they're going to cut it back down to once a day. So we'll see how that goes. But I want to dispel some of the rumors, some of the things that were in what Dave told us. They give you the worst case scenarios. I've had it done 5 times. I've never had any kind of bleeding. I've never had it where the PICC line fell out. I never had any of those things. It doesn't hurt. When you have it put in, it doesn't hurt. I've had it put in the infusion center, in a special room they put it in. It's like getting an IV put in. It's more intimidating when they tell you we're going to put a PICC line in. That's intimidating. Them telling you that they're going to do it, that's the scary part, to be honest with you. It doesn't hurt. They put some Lanacaine or whatever. They put something topical on your arm to numb you. And they make a small incision, a minute thing, and they stick the tube in. It doesn't hurt, believe me when I tell you, because I'm a big chicken when it comes to pain. But it doesn't hurt. And they put it in, and they put the dressing on it. And in my case now, a nurse, even though my wife is a nurse, then they send a nurse once a week to the house to change the dressing. My wife does the hookup on me. You don't have to be a nurse to hook up the antibiotics. It's very simple. I could do it myself. It just so happens my wife is a nurse, so she does it. But there's nothing to it. There is nothing to a PICC line, trust me. As long as you keep the area clean, there's nothing to it. It doesn't hurt going in, and it doesn't hurt coming out. As I said, I've had it done 4 times. I've also had a central line in my neck, and believe me when I tell you, you talk about scary when they tell you they're going to do that. But again, you don't feel it. You honestly don't feel it, and I wouldn't lie to you about that. Trust me. It's good. The only drawback to it, and they tell you in all these papers and books, they can draw your labs from it. Here's the thing. A phlebotomist cannot draw labs from a PICC line. The only one who can draw your labs is a nurse or a doctor, I guess. But the technician in the hospital who comes around, they can't draw your labs from it. The people that come up from the lab, they can't draw your labs from it. The only one that can draw your labs from a PICC line is a nurse. So that's a little bit shady there. I know when they first told me, don't worry, they can take your blood test from there. I was like, okay, beats the heck out of getting stuck with a needle at, 6 in the morning like they do in the hospital. But when they came up the first morning, the girl came up and she said, I'm sorry, Mr. Apple, we have to take your blood. I was like, go ahead, I got a PICC line. They said, I'm sorry, we can't use the PICC line. I was like, wait a minute, they lied to me. Only the nurse can take blood from the PICC line. That's because once they take it, they have to flush it, and then they have to run heparin through it so that you don't get a clot in the PICC line. So it's involved. It's involved when they take blood from the PICC line. It's also involved once they run the antibiotics or whatever they're running through it. They have to flush it with saline. They have to pull it back to make sure that they get a blood flow back through it to make sure there's no clotting, and then they have to pack the line with heparin. So there's some work involved when they use the PICC line. So that's where they have to have a nurse do it. But anyway, I want to thank you for being here today. I hope this information was helpful and interesting to you. And I want to remind you, no one ever went blind by looking at things from the bright side, so give that a shot. Things can always be worse. And do me a favor, be the reason somebody smiles today. Give them a hearty handshake, a wave, a smile, pat on the back. But be the reason somebody smiles. You're going to be surprised how good you feel when you make someone else smile. Hey, you've been listening to an Apple a Day's the Fritter. I'm your host, Jimmy Apple. Hey, we got some good news. We've got a couple of interviews that are going to be airing this week. We have one lady that talks to ghosts. You're not going to want to miss that. Trust me. But we'll be back again tomorrow with another apple fritter. Comes out at 4 a.m. We're up with the elves. We're making them fresh for you. So have a great day today, my friends, and we'll talk to you again tomorrow.
Join Jimmy tomorrow for another apple fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.